Hi! In this video, we'll show you how to best manage your diabetes, what treatment options there are, and which devices are available to you. MDI stands for multiple daily injections. It's the basic treatment option for type 1 diabetes. MDI will help you to imitate the normal state of your body. It's quite simple. This is how it works. MDI requires two forms of insulin. The first is called basal insulin and is long-acting. It needs to be injected once or twice a day to achieve optimal levels throughout the day. The second is called bolus insulin and is injected before each meal. To calculate the right dose of insulin, you have to measure your glucose levels several times a day. You do this before and about 2.5 hours after main meals. So at breakfast, lunch, and dinner, as well as before you go to bed, and sometimes during the night. Based on your glucose level and the amount of carbohydrates in your meal, you can calculate the right dose of insulin required. Carbohydrates are found in foods containing starch, dairy products, and fruits. At the beginning, this may sound quite complicated. That's why your diabetes team is here to support you and determine the insulin doses. As you grow older, you'll learn to calculate the right insulin dose by yourself. In any case, the target for your blood glucose level is between 4 to 6 millimoles per liter before each meal and below 10 millimoles per liter after a meal. These are also ideal levels for people without diabetes. If your blood glucose level is below 4, this is called hypoglycemia or hypo. You'll likely notice this through shaky hands and fingers, sweating, and finding it more difficult to concentrate. What you need now is sugar. Fast-acting sugars such as glucose or sugar from fruit juices will help you most rapidly. 15 to 20 minutes later, you should recheck your blood glucose level. If your glucose level is now above 4 millimoles per liter, your additional sugar intake was fine. If your level remains below 4 millimoles per liter, you'll have to repeat the sugar intake until your glucose level is at least 4 millimoles per liter. On the other hand, if your glucose level is too high, you have what's called hyperglycemia. As you already know, you have to inject insulin to correct high glucose levels. The target of such a hyperglycemia correction is 6 millimoles per liter. The formula to calculate your correction dose will be provided by your diabetes team. There are many technological advances and devices that can make your everyday life with diabetes easier. For example, continuous glucose monitors, the CGMs. These little devices inform you or your parents about your glucose values, and particularly they alarm you if your levels are too low or too high. In addition to CGMs, there are insulin pumps. Insulin pumps function based on the same rules as those for MDI therapy and therefore are very suitable for MDI experts. The most convenient option is the hybrid closed-loop system, including both devices, a CGM and an insulin pump. The CGM sends the glucose levels directly to the pump, and the pump delivers the relevant amount of insulin. The only thing you have to do is to calculate the amount of carbohydrates you eat. Novel treatment options are rapidly appearing on the markets. Your diabetes team at the hospital is ready to discuss the most modern ways to treat your type 1 diabetes and find the best treatment option for you and your family.